Hi, my name is Kaitlyn Stockley, and I'm a public speaker. Today I will be presenting to you a speech that I wrote and performed for the Lions Club. Have you ever embarked upon a challenge and had something keeping you from reaching your final goal? This is the harsh reality for Pam Sheaves and Kevin Carter. These Newfoundland residents took it upon themselves to better their own health. Over years of diet, vigorous exercise, and healthy lifestyle choices, they were successful in losing hundreds of pounds in excess weight. And we applaud them. However, they are now faced with an overwhelming burden of an excess skin removal surgery that the government refuses to pay for. The government and its medical care plan consider the excess skin removal surgery to be cosmetic. By definition, cosmetic surgery is the use of plastic surgery in order to improve a person's appearance. As recently discussed on the local news, excess skin can make day-to-day things more difficult. For example, something as simple as getting dressed. It may even limit a person's mobility, not to mention the hygiene and medical problems associated with the many folds of loose skin. Chronic skin-on-skin contact can result in rashes, irritation, and other sores that can lead to infection. So I ask you, does this sound like your everyday, run-of-the-mill appearance adjustment, such as the famous tummy tuck, eye lift, or breast enhancement? Pam Sheaves is a type 2 diabetic who lost over 150 pounds. Yet, she still has 20 pounds of excess skin that needs to be removed. Complications from excess skin hold a tremendous concern for Sheaves. Diabetics are more than twice as likely to be hospitalized due to infection as those without diabetes. Still, our government's MCP will not cover the surgery. As Pam Sheaves said, unless you fall within that little box that they have written, and believe me, they have all their I's dotted and their T's crossed. You fall outside that little box in any way, and you're completely thrown out of the system. With the procedure totaling close to $7,000, Pam Sheaves is left not knowing where to turn. Another unjust case is that of Kevin Carter, a Botwood man suffering from excess skin after losing 175 pounds. Since his weight loss, he has been prone to infections and chafing in the folds of loose skin. Carter has 2 letters from physicians saying that it is a necessity to his health to have the excess skin removed. Recently, Mr. Carter received a letter from the Health Minister of Newfoundland and Labrador, Suzanne Sullivan. The letter states that the upper part of the abdomen is considered cosmetic in nature. However, as Mr. Carter states, when I went to the plastic surgeon, I never went to inquire about getting the upper part of the stomach removed. I just wanted the infected areas removed. Although the government is denying his medical treatment, Mr. Carter says that he will not give up and states that from now on, I will be going to the doctor to have every infection documented and every bit of pain and irritability in those areas noted. I ask you, is this any way to live? Yes, I believe that the tummy tuck, the eye lift, and breast enhancement are all cosmetic surgeries and should not be covered by our government's MCP. However, I also believe that there is a fine line between an appearance adjustment and a medical condition. Why prolong suffering? This could potentially diminish future medical bills. Not to mention, without the weight loss, future medical bills from potential heart problems, diabetes, and any other medical conditions associated with obesity. Tommy Douglas, the founder of MCP, once stated that we would provide health care to every man, woman, and child. We need to stand up for our fellow Newfoundlanders and say that it is not okay to deny someone of their basic necessity of the healthcare system. So, cosmetic, surgery, or medical condition. Let the documented infections speak for themselves. Thank you.